All right, Dad. Tell the world who you are.
Well, my name's Winston Wong. I'm a family physician. I was trained at UCSF, a very prestigious medical school, and I also finished my training in Seattle. And I've been a doctor for 35 plus years. I've seen a lot of patients, and I've been in community health clinic settings as well as in health planning, both at the government and private sector levels.
All right, and what are you going to be talking about today?
Well, I think, one of the things about doctors and people is that, and I know this myself, is sometimes we're kind of too embarrassed to talk to our doctors because we think that there's a lot of things in our bodily functions that a doctor wouldn't understand or is offensive. But I can tell you, as a doctor, pretty much we've seen it all. And I wanted just to talk about things that maybe people haven't really wanted to talk to their doctor about. But they're both funny. And, sometimes we can maybe point out things that make things less mysterious. And maybe there's a reason for you to see a doctor for.
So just to clarify, this is kind of practice for your upcoming podcast. Is that correct?
This is about doctors unwired and being the grossest but most frank kind of conversation you can have with your doctor, because we don't have these kind of conversations with our doctors. You got to be able to say, hey, how come my snot really looks like it's green all the time? Or how come, whenever I wipe my ass, it really smells bad? Because sometimes it really means something, and sometimes it's just part of being a human being.
Shouldn't your ass always smell if you wipe it?
Well, let's say you wipe your ass, you see a little bit of blood.
Oh, God.
You say, oh, Jesus Christ, what's going on here, man? Am I doing internal bleeding? Or maybe my I don't know, maybe I had some, I screwed around there and I ruptured something, man. Some blood came out. We don't know, but you'd be able to talk to your doctor about it.
Okay.
And I'm going to be able to break those walls. Because there's been too many walls between, things that we're embarrassed to talk about and that we need to be able to say is really everything that we can understand from a clinical basis.
Okay, so before we start off your first story of this podcast, what did you want to name this podcast?
I don't know yet. Dr. Gross by Winston
Dr.
Wong.
Gross? I thought you had a different name earlier.
What was my name before? I don't remember.
Disgusting.
Oh, yes. Disgusting. This is podcast Disgusting Medicine.
Okay. Sounds great. So let's let the internet know what your first story, your first episode.
Well, okay. Let me think. Okay, let's pause. I don't know what I'm going to talk about yet.
It's okay. I can cut this part out.
What do you think would be good for me to talk about? Give me something.
Warts.
Oh, God, warts are easy.
Too simple?
Think of something better.
Cysts.
Oh, cysts? What does a cyst mean anyway? Jesus.
I wouldn't know. You're the medical guy.
What do you see every day, Connor? What do you worry about?
Pimples.
A pimple?
That's what I worry about. I still break out for a 26-year-old.
Okay, we'll talk about acne. Because I think most of you guys out there, I don't think there's probably anyone in the world who never had acne, that zit, especially on your nose, becomes really red and the pus starts coming out and then it's it's really tender. Well, the thing is, acne's been around humans pretty much since we came out of the cave. And there's been a lot of work to try to figure out what causes acne. And really, to tell you the truth, it's not absolutely clear. But there's probably a different number of reasons. It's largely because of hormonal changes that cause this kind of different bacteria to start setting up shop in some of the oil glands on the face, as well as sometimes the oil glands become a little bit kind of clogged up, and that the outlets for the oil glands to emit become a little bit tortuous. So anyway, you get this zit. We actually call acne by different levels of acne. You know, doctors always do. It's like, this is first stage acne. You know, there's second stage, third stage. They basically talk about whether acne is pretty much run-of-the-mill acne versus other people who are getting acne that really causes some scarring and maybe and potentially some serious infections. But everyone's kind of probably, you know, say, God damn, that zit's really on my face right now. And they take a fingernail and you try to kind of push and squeeze out kind of the pus. And it kind of feels good because it kind of rushes out. And then you get to kind of squeeze out that yellow stuff. You know, that's probably what most of us have done. It's not a good idea. The reason why is because when you push out that zit stuff, most of the time your fingernails are not like 100% sterile. And before you know it, you actually have some bacteria underneath the fingernails. And you get that bacteria underneath the skin, you can cause even kind of worse infection. I actually even had that a long time ago when I was a teenager. Has nothing to do with masturbation.
What? Why would you bring that up?
Oh, that's part of the old code. They used to say, hey, you know, that 12-year-old kid, especially boy, he's starting to get some zits, man. He's probably jacking off every day.
I've not ever heard that.
That's been an old common thing because the correlation between puberty and acne was pretty strong, of course.
Okay.
So, you know, then these boys would feel kind of bad about it. Say, shit, you know, Dad knows I'm jacking off every day or something like that. But
I don't think people think that anymore.
No, yeah, still thought. So anyway, you know, most of the stuff that you get over the counter, actually in the old days, it used to be basically something to dry up the skin. Very little kind of really therapeutic action, but probably better than nothing. Washing your face constantly has actually been shown not to really help a lot. In fact, scrubbing and irritating your skin probably makes it worse, and you might feel like your skin is less oily, but it doesn't really make that much difference. Now, in the last 30 years or so, I get a lot of stuff at the pharmacy, you know, that you can just buy without prescription. It has a little bit of antibiotic kind of action, which seems to help more than the first generation of acne medicine in the past. But I think most people then say, do I need more because I'm still cropping out zits like every time? And I think probably those zits, sometimes you do need to see a dermatologist or a family doctor, and they will prescribe stronger medications, which are known to be pretty effective, called Retin-A, Accutane, vitamin A. But the problem is that some of the really most effective drugs in that class of drugs can cause actually birth defects for women that might be pregnant. So we have to be very careful of those things. Not to mention some of the drugs are associated with some increase of chance of having some depression, which is actually a problem across the board for almost all young people with teenagers. So that's kind of what the acne is right now. But I think one of the things that we always worry about is I ate like Cheetos, chocolate, French fries, and I broke out. The evidence with regards to eating certain foods and actually having croppings of acne is not super strong.
Really?
It may be that what happens is that people tend to eat these foods and they feel kind of stressed out because they're comfort foods. Like, hey man, I gotta grab those chips because I feel like it because I've had a bad day. And then the thing is, we do know actually that stress, because it's very much related to hormonal changes in the body, can probably cause increased breakouts. So it's not very strong that you say, hey, I'm allergic. Whenever I eat Cheetos, I get zits. People say that, but there's never really been very good studies or case studies that really show that's very strongly correlated. So, I think the thing about acne, most people don't have acne after age 25 or so.
So that's my body.
But occasionally people do, especially women who are on birth control, because birth control pills and also IUDs, some IUDs have hormones in them, and the hormonal things can aggravate acne. Interestingly, sometimes birth control pills can help acne too, because they might stabilize the hormonal levels in certain women.
So, Dad, have you ever had to pop a really nasty pimple for a patient?
About the closest I've done is you can sometimes take a really thin needle to go into a really juicy zit and inject some corticosteroid in there, cortisone, so to speak.
Okay.
And it relieves inflammation and can make it heal faster. In fact, the first time I saw this was of a dermatologist, doctor, a young woman, when I was a medical student, and she had a zit that was growing on her cheek, and she actually self-injected herself with a small needle of cortisone into the zit, and she was a dermatologist. So when I said that, I said, I guess that works. She actually had pretty good skin, and she was about 26 years old. You do see it once in a while. I've seen pretty bad acne, with frankly,
what's the worst?
There's some guys, I think it tends to be worse in guys more than women, but I've seen some guys like the whole head was basically one zit. It seems,
oh my God.
Because they had they have a lot of swelling and inflammation. It's like a lot of redness and, scarring, pitting, and I felt bad for those guys. Actually, for people with really bad acne, there's a strong correlation with a lot of depression. Maybe because of how they think people perceive them, but maybe there's also because they're hormonal things that depression and acne might be strongly related to one another.
I had pretty bad acne in high school.
Yeah, well, it tends to be a little bit familial, and actually, if you look at teenagers, about 90% of teens get acne, but
I had acne so bad that one of my teachers thought I was being abused.
Well,
yeah,
I'm sorry to hear that. I think your acne, I don't want to get personal. Your acne was moderate. It wasn't the worst. It certainly was not the worst I've seen. Far from that. So,
what's some of the nastiest you've seen?
Like I said, the one guy who was walking around looking his whole head was a zit. But
you ever see anything like on someone's back or anything like that?
Oh yeah, I've seen a lot of
giant one.
Back acne can be pretty severe. There's actually beyond teenage acne, kind of run of the mill hormonal structural problems with kind of how the fat underneath the skin causes kind of inflammation. There's different kinds of acne. If you take certain medications, it can cause acne. And there are certain kind of genetically related skin diseases that they show up as acne, but it's not really underlying kind of the run-of-the-mill teenage acne, let's say. Acne business is a big business because, as you know, what's that company that sells the acne?
Proactive.
Proactive. It's a multi-billion-dollar industry because there's so many people that are concerned about, I use
some products.
I'm so concerned about the acne. It's a big consumer industry for people trying to control their acne. I would say that generally most people are okay served by the things that you can buy at the drugstore, neighborhood drugstore, and if it's not well controlled, probably see your doctor that can only they can prescribe certain medications, and generally that probably helps for about 90% of all acne. It might not make it disappear, but it will really greatly control the amount of acne that comes up.
Okay, well, I think we can wrap it up we'll call this like a preview into before the first official episode of a disgusting
we should talk about
podcast.
There's a lot of other things to talk about that are gross that people don't like to talk about. It's like, how about my toe jam, and how about if I what about when I have boogers coming out of my eyes.
Okay.
What about you know, what happens if my shit kind of like floats on the toilet bowl? What does that mean? You know,
Okay.
there's all sorts of things, because I think people should know a little bit about what's happening to their body and not be so embarrassed or ashamed or have a difficult time explaining the things that they're having.
So maybe, are you saying in the future you'd be curious to have listeners to send you kind of woes
absolutely.
and worries?
If you please send me your questions, I'd be really happy to hear what you guys are thinking about, because I need to know. And there's, if I don't have the answer, there's at least some studies out there that might. Yeah, I think there's great questions. I mean, we don't know everything that's happening to the body, that's for sure. So please send in your questions and your comments. They're really welcome. We're trying to develop a Patreon group. Patreon group.
Being hip with the
turn on to the
kids.
next episode of Disgusting Doctor.
Okay. Do you want to say any closing remarks? Is there any thank yous?
Oh yeah, I want to thank my son,
Winston.
Connor Wong. Connor
Oh,
Wong.
God.
He's recording here, and thank you for my producer. I think this is a start of a great series, because I think we can only do better because people who know more about what's going on with their own bodies can help themselves, and that's really part of the key of keeping ourselves healthy, as well as kind of controlling the cost of healthcare, because we don't have to call the doctor or see the doctor for every little thing that we're not sure about.
All right. Thank you all for listening, and see you next time.
Thank you!
Oh, God.